Good day, this is Professor Will, CBMD PhD. Today, Sunday, March 29, 2020. It is 4:32 and 2 seconds p.m. Eastern Standard Time. And this is a continuation of my lecture on Corona series. So let's get started here. Some COVID-19 patients still have coronavirus after symptoms disappear. Date, March 27, 2020. Source, American Thoracic Society. Summary. Researchers found that half of the patients they treated with mild COVID-19 infection still had coronavirus for up to 8 days after symptoms disappeared. Researchers collected samples from throat swabs taken from all patients on alternate days and analyzed. Patients were discharged after their recovery and confirmation of negative viral status by at least 2 consecutive polymerase chain reaction PCR tests. The most significant finding from our study is that half of the patients kept shedding the virus even after resolution of their symptoms. The primary symptoms in these patients include fever, cough, pain in the pharynx, pharyngalgia, and difficult or labored breathing dyspnea. Patients were treated with a range of medications. The time from infection to onset of symptoms incubation period was 5 days among all but one patient. The average duration of symptoms was 8 days, while the length of time patients remained contagious after the end of their symptoms ranged from 1 to 8 days. 2 patients had diabetes, and 1 had tuberculosis, neither of which affected the timing of the course of COVID-19 infection. If you had mild respiratory symptoms from COVID-19 and were staying at home so as not to infect people, extend your quarantine for another 2 weeks after recovery to ensure that you don't infect other people. COVID-19 patients can be infectious even after their symptomatic recovery, so treat the asymptomatic recently recovered patients as carefully as symptomatic patients. The researchers emphasized that all of these patients had milder infections and recovered from the disease, and that the study looked at a smaller number of patients. They noted that it is unclear whether similar results would hold true for more vulnerable patients such as the elderly, those with suppressed immune systems, and patients on immunosuppressive therapies. Reusable respirators might be a suitable alternative to disposable respirators. Date, March 26, 2020. Source, Baylor College of Medicine. Summary. Researchers have found that reusable respirators might be a suitable alternative to disposable N95 respirators currently in high demand. Training and fit testing healthcare providers on respirators can be time-consuming. In an epidemic, we want to train and fit test a large number of workers quickly. In this study, the researchers compared the time it takes to fit test and train healthcare personnel in the use of disposable respirators versus reusable elastomeric half-mask respirators that provide the same level of respiratory protection as N95 respirators. They found that healthcare personnel learned to use the reusable respirator quickly, and that it took no more time to fit test them than it would take a disposable respirator. Our study shows that training and fit testing workers on these reusable respirators does not represent a barrier for possible use by hospitals. Our researchers said, an advantage of reusable respirators is that there is no need to stockpile them. The 2019-20 coronavirus pandemic is an ongoing pandemic of coronavirus disease 2019, COVID-19 caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. The outbreak was first identified in Wuhan, Hubei, China. In December 2019, was recognized as a pandemic by the World Health Organization, WHO, on 11th of March, as of 29th March 2020. More than 713,000 cases of COVID-19 have been reported in over 190 countries and territories, resulting in approximately 33,500 deaths. More than 150,000 people have since recovered. The virus is mainly spread during close contact and by respiratory droplets, produced when people cough or sneeze. Respiratory droplets may be produced during breathing, but the virus is not generally airborne. People may also catch COVID-19 by touching a contaminated surface and then their face. It is most contagious when people are asymptomatic, although spread may be possible before symptoms appear. The time between exposure and symptom contact is typically around 5 days, but may range from 2 to 14 days. Common symptoms include fever, cough, and shortness of breath. Complications may include pneumonia and acute respiratory distress syndrome. There is no known vaccine or specific antiviral treatment. Primary treatment is symptomatic and supportive therapy. Suggested preventive measures include hand washing, covering one's mouth when coughing, maintaining distance from other people, and monitoring and self-isolation for people who suspect they are infected. Health authorities in Wuhan, the capital of Hubei, province China, reported a cluster of pneumonia case of unknown cause on December 31st, 2019, and an investigation was launched in early January 2020. The cases mostly had links to Huon and seafood wholesale market, and so the virus is thought to have zoonotic origin. The virus that caused the outbreak is known as SARS-CoV-2, a newly discovered virus closely related to bat coronavirus, pangolin coronaviruses, and SARS-CoV. Good day, this is Professor Will, CBMD PhD on infectious disease and microbiology. Hope you enjoyed listening and have a great day.